Is Mike Bezoff. I am the Seniors Housing Manager in the Southeast region, the first region of the Seniors Housing Unit to launch the integrated service model almost a year ago. So I will be your host tonight for these festivities, and hopefully we can share with you some important information and some useful information, and hopefully we'll have some time to get some feedback from tenants and questions. If we go to the next slide, please. So today's, we went a little too far. Can we go back a couple, please? One more. There we go. Thank you. So the purpose of this evening's meetings is to inform tenants on the progress of the integrated service model, provide an update on phase 1 of the integrated service model in the Southeast, and then answer questions from tenants. So we have a number of staff with us today. Can go to the next slide, please. And first, I'd like to introduce the Southeast team that are with us today. I've introduced myself. I'm the regional manager. We have Rajan Bruce, who is our tenant engagement and services supervisor. We have with us Anna Mararu, who's our community housing supervisor. We have Jane Irving, a senior services coordinator, who will later speak to some of her role. We have Michaela Sierro, a tenant services administrator, and Camila Dyer, who is one of our senior superintendents in one of our buildings. In addition to that, we have a number of the senior housing unit staff and city staff with us tonight. We have Grant Coffey, our interim general manager for the seniors housing unit. We have Brad Priggin, assistant general manager. Jaypreet Kohli, who is our manager of access and support. Leslie Hamilton, regional manager Southwest, who's our newest manager joining the team, and we're very happy to have her with us. Michelle Davis, who's the regional manager in the Northwest. Patricia Santana, our administrative assistant to the general manager's office. Marin Musabelli, business planner, and Alana Slopiak, our business planner. Both Marin and Alana are newly with the team as well and have made great contributions since they've been here. And last but certainly not least is Wendy Dobson, our program manager for the seniors housing unit. And with Grant taking on the leadership role as interim general manager, Wendy has moved into that role with us. And of course, we have with us from the City of Toronto, Andrea Austin, manager, senior services and long-term care from the City of Toronto. Thank you.
On the agenda this evening, we'll be speaking about the land and African ancestry acknowledgements, Webex overview, integrated service model, Southeast region, COVID-19 vaccinations and updates, Toronto Seniors Housing Corporation, and questions. Next slide, please. I would like to start by honoring the land that we are on, which has been the site of human activity since time immemorial. It's the traditional territories of the Huron-Wendat, Anishinaabe, Chippewa, Haudenosaunee Confederacy, and most recently, the Mississaugas of Credit River First Nations. Ontario is covered by 46 treaties and other agreements and is home to many Indigenous nations from across Turtle Island, including the Inuit and Métis. These treaties and other agreements, including the One Dish with One Spoon Wampum Belt Covenant, are agreements to peaceably share and care for the land and its resources. Other Indigenous nations, Europeans, and newcomers were invited into the covenant in the spirit of respect, peace, and friendship. We are mindful of broken covenants, and we strive to make this right with the land and with each other. Next slide, please. African ancestral acknowledgement. We are all treaty people. Many of us have come here as settlers, immigrants, newcomers in this generation or in generations past. We would also like to acknowledge those who came here forcibly, particularly as a result of the transatlantic slave trade. Therefore, we honor and pay tribute to the ancestors of African origin and descent. The code of conduct for this evening, we ask that you be brief, limit yourself to one question and comment at a time. Be a good listener and keep an open mind. Submit your questions or comments in the Q&A box, or if you are attending via phone, hit *3 to raise your hand and to lower your hand, and most importantly, be respectful. Next slide, please. Webex and accessibility. For tenants who require an accessibility-related accommodation to participate in the information session, using adaptive technologies may work best when with the telephone. Panelists will be describing the content on the slides during the presentation as well. Using Webex Q&A online. Click the Webex Q&A button at the bottom right of the video window. Type your question in the box to the lower right hand of your screen and click Send. Only staff will be able to see your questions. Your questions will be directed to relevant panelists and answered during the Q&A period after the presentation. Next slide, please. Using Webex Q&A over the phone. Enter *3 on your phone to raise your hand and to lower your hand. When prompted, enter *6 to unmute yourself. Your name will be placed in a queue based on the order of who raised their hand first. The moderator will select and individually unmute participants with their hand raised icon. When you are selected and unmuted, you will hear a beep and a voice that states that you have been unmuted. This means that you can ask your question. Protecting your privacy. This is a public event that is being recorded. The recording and presentation materials will be posted on TCAT's website at torontohousing.ca/ISM. If you are asking a question, please do not share any personal information such as your last name, address, etc. To discuss a private matter related to your tenancy, please contact the TCAT Client Care Center at 416-981-5500. I'll now be handing over to my manager, Mike, for that Southeast Region ISM update. Thanks.
Thanks so much, Reja. I appreciate it. So we'd like to just review for a few minutes, review the integrated service model and the 4 key innovations that are incorporated in it. So if we can go to the next slide, please. So as part of the integrated service model, ISM, so I will use ISM mostly, there were 4 key innovations. The first was a new staffing model. The second was senior-specific policies and procedures. The third were seniors' health and wellness hubs, which we'll talk to a little bit later. We'll talk to all of these in a bit. And designated provincial care coordinators. So to get into more detail, if we can go to the next slide, we can talk about feature number 1, which is the new staffing model. So part of the new staffing model includes increased staffing levels across all seniors buildings, new tenant-facing positions, which is the Seniors Services Coordinator. In the Southeast region, there are 8 of those, and we'll have time later to hear from Jane to talk about her role. A new administrative position, which is the Tenant Service Administrator, which is 4 in the Southeast region that support tenants from an administrative perspective and work closely with the Senior Services Coordinator. And Michaela will be able to talk to that as well later. We've had expanded training on issues affecting seniors. So to date, we've completed mental health awareness and understanding dementia training with the staff, all staff, including management. So every staff member within the seniors housing unit, including our GM and our managers, have done the training. And the next session coming up is suicide prevention, which will be coming up in January 2022. We'll go to the next slide, please. The next feature of the ISM are senior-specific policies. So taking existing TCHC processes, because we are currently part of TCHC and we have policies that we do follow, but we've looked at those policies and put procedures in place that are more specific to seniors' needs. So we're updating and developing new processes, and we're currently testing many of these processes in the Southeast region. The certain areas of focus that we had were the tenant needs assessment, referrals and consent, integrated team meetings, eviction prevention and arrears collection, and partnership agreements. Some seniors struggle to maintain their units in good condition due to complex health challenges and require barrier-free access to health and community service supports to enhance their ability to age in place. So it's necessary to have specific processes that address those concerns. We can go to the next slide, please. So one of the key processes that we implemented as part of the senior specific policies was the tenant needs assessment. So there was a lot of discussion and a lot of work that went into identifying this tool for our senior services coordinators. And during our testing phase of the needs assessment, we had 170 needs assessments completed with tenants. Out of those 170 tenants that we completed the assessment, 67% of the tenants required supports. And out of those 67%, 90.4% of tenants who required and accepted support, which is a key to the support piece, which is tenants being open to accepting, 90.4% were provided with referrals and or other appropriate supports. And when we talk about supports, it's not always about having a personal support worker or a mental health worker. It could be support with day-to-day tenancy needs as well. So this really contributes to our focus on providing supports for tenants. It's a tool to help with early identification of seniors' changing needs. It helps in monitoring and determining what supports and referrals are required. And that is a big piece to create a database of what supports may be more prevalent in what communities. Creates a baseline of requirements. The needs assessment is to be conducted at least once a year with each tenant. And it also is done 30 days after move-in with new tenants. And it also is done as needed when tenants express a desire to speak with an SSC about any support needs they may have. We can move on to feature 3, please. The Seniors Health and Wellness Hub. So part of the original vision of the integrated service model was to have in each region an on-site specific seniors health and wellness hub that provides social activities, etc. It provides tenants with access to a range of health, social, and wellness services delivered by external community agencies. These are not like the service hubs in the family side, and these are specific services offered in the hubs will respond to building and community needs. Important to note that the implementation of the wellness hubs is currently on hold pending further tenant consultations, which will be done and led by the City of Toronto. Consulting tenants about the wellness hubs is a priority, and more information on how to take part in the process and provide your input will be shared in the coming months. While we are doing consultations, programming will still be available in seniors housing unit buildings where possible within COVID-19 health guidelines. Next, please. So, designated care coordinators. Care coordinators are a liaison between patients and healthcare providers. We have a partnership with Home and Community Care Support Services, formerly known as the Toronto Central Local Health Integrated Network, or the LINS. We have designated care coordinators in the Southeast that are assigned to each building and work very closely with the senior services coordinators. And we have provided and engaged in joint orientation and training between the care coordinators and our seniors housing unit staff. Reviewing existing partnerships and opportunities for improvements to better support services to tenants aligned to tenant needs assessment process. And as part of this process, there are 4 virtual hubs that have been created and established with our primary and community care partners in the Southeast region during COVID. And these hubs provide an opportunity for our senior services coordinators to access our partners and bring forth cases that may require additional support, and bring tenants forth with consent, obviously, to share with the team and garner better supports for the tenants. Next slide, please. The integrated service model and accountability. So as you know, Toronto Community Housing Corporation currently, which is we are part of, will directly deliver, excuse me, the integrated service model in seniors buildings. The ISM implementation is accountable to TCHC until the new Toronto Seniors Housing Corporation assumes operations of the 83 buildings in June of 2022. The City of Toronto and Andre's team will oversee and evaluate the ISM to ensure it is making a difference in the lives of seniors. The accountability framework, which is very large and very detailed, outlines how the City of Toronto will oversee and evaluate the model. There are a number of metrics, too many to identify and share, that the city will be monitoring and evaluating. The ISM annual program report by the Seniors Housing Unit and an evaluation report from the city will be coming out in Q1 of 2022. If outcomes are suboptimal, the city will work closely with TCHC to ensure appropriate action is taken to effect change. So we are accountable to our tenants and to the city to ensure that the integrated service model is effective and is doing what we want it to do. Thank you. Next slide, please. So prior to the launch of the integrated service model, a tenant service experience survey was held. It was conducted in the original 18 buildings of the phase 1 ISM buildings. The Southeast region has now grown to 23 buildings. It creates a baseline for evaluation of the integrated service model and how it's affecting, the tenant experience. A final report to the Tenant Services Committee will be given on November 18th. Results will be posted on the TCHC ISM webpage at torontohousing.ca/ISM. The next survey will be conducted after the change to the new corporation, so after June of 2022. Next slide, please. A critical and vital piece or component of the integrated service model is our Senior Tenants Advisory Committee. The committee is an advisory board created to inform the design and implementation of the integrated service model, ensuring tenant voices are heard. At the last meeting of the Tenants Advisory Committee, or STAC, on November 15th, we discussed annual unit inspections and maintenance and the tenant experience survey, and garnered a lot of good feedback and recommendations from the committee that we can look to implement as we move forward towards the new corporation. On December 13th, the STAC contributions and impact over the last year, feedback on communications about Toronto Seniors Housing Corporation. Currently, they are actively recruiting members, and you can apply. And if you do apply, please apply by Wednesday, December 1st. If you have access to online applications at torontohousing.ca/STAC. If you need any assistance or have questions, you can email stac@torontohousing.ca or call at 416-981-6601. And I would encourage anyone who wants to be heard and have a hand in forming how we move forward, that this is a great opportunity, and it's a great forum for sharing and learning. And I do not attend STAC on a regular basis, but I did attend the latest meeting, and I thought it was very useful, very professional, and eye-opening to hear what our tenants have to say, because that's why we're here, for you. Okay, next slide, please. So the integrated service model upcoming activities. So we have implemented phase 1 back in December 11th of 2020. We recently launched in the Northwest region with Michelle's team. The phase 3 implementation will be March or April of 2022, which will include the next 2 regions, both the Southwest and the Northeast. Obviously, planning for seniors' health and wellness hubs and the consultations with the city. We talked about recruitment for the seniors tenant stack. We will release the tenant experience survey results. We'll have an annual report. We will see the ISM evaluation report from the city. And we are planning the transition, which is a big job, right? The transition from TCHC to TSHC, Toronto Seniors Housing Corporation. In preparation for the phase 3 implementation, we've already started recruiting for staffing for the phase 3. And we've learned a lot in the last two phases. So we're getting better at how we prepare and staff and hire and communicate. So next slide, please. So the next tenant information session will be December 8th from 6 p.m. to 8 p.m. And this will be focused on the information on the implementation of the ISM phase 3. Additional regional information sessions will be coming in 2022. So today's session is really a focus on the Southeast region and the initial launch, but we will have many more discussions as we move forward. For any updates that you might want to have or how to attend events, view recordings, because these sessions are recorded and the presentations are posted as well as the recordings, visit our website at torontohousing.ca/ISM. Let's talk a little bit about the Southeast region. So if we can go to the next slide, please. So at the beginning of our session, we introduced some of the regional staff. So this is a small organization chart of the Southeast region. And if you notice at the bottom is our senior tenants, and they are the foundation that we are built upon. That is why we're here for you, the seniors tenants. So regional manager is myself. Réjean Bruce is our tenant engagement and services supervisor. And working with Réjean, our senior services coordinators, our tenant service administrators, our operating unit clerk, and our leasing clerk. On the other side of the chart, we have Anna Moraru and Constantine Veronin, and Constantine could not be with us today. It's his anniversary, so he's preoccupied. So these are our community housing supervisors, and they manage the superintendents, the cleaners, and the custodian maintenance people who do cleaning and maintenance in your buildings. So they manage the operations of the buildings, and on Réjean's side, they manage the tenancy management piece. And it's all focused on services to our seniors tenants. So you've probably heard me talk enough, and you're probably tired of that. So I'm going to ask and call upon Jane Irving, one of our senior services coordinators, just to talk about a little bit about the senior services coordinator, her role and her experiences. So off to you, Jane. Thank you.
Thank you, Mike. So my name is Jane, and I'm a senior services coordinator.
Can we get the next slide, please? Thank you.
And this just kind of goes into some details about what this role entails. So it's very tenant facing. So we now we have office hours in all of our buildings where we can meet with tenants in our office or in their unit. And our contact information is posted clearly in all of the buildings. So even if you need to speak with us and we might not be on site, you can still give us a call and we can speak on the phone. And so the idea of the role is to provide direct tenant support. And so ideally, we are involved with the tenants right from the lease signing. So we're meeting with them to sign the lease, and we're arranging with the site staff so that the move-in process goes seamlessly. And then we're also checking in with the tenants to see how they're settling into the building and to see if they need to be linked to any services in the community. So as Mike mentioned, we complete the needs assessment, and then we will also follow up with the tenant at later dates as well to check in and see how they're doing. We also support referrals. So if we identify that a tenant requires some services in the community, we can speak to the tenant to get their consent, and then we can make appropriate referrals to community agencies. For example, we might identify that a tenant is having difficulty preparing meals. So we can talk to them about making a referral for Meals on Wheels. Or if they're having difficulty getting to appointments, we can talk to them about transportation options available to them. We also provide ongoing tenancy support, where we are assisting with things like the annual rent review or other paperwork that the tenant might be having difficulty with. We would be happy to meet. Next slide, please. So this just kind of goes into more detail where, as a senior services coordinator, we would do needs identification to see if there are services that a tenant might benefit from in the community. Or if a tenant is speaking to me and they mention that they had a fall in their apartment, that would prompt me to speak to them about making a referral for home and community care. Maybe the person needs an occupational therapist to do a home safety assessment, to recommend equipment in the apartment, or maybe they need help with personal care. So it's a foot in the door where we can establish that relationship with the tenant and then support them ongoing as they need it. We also work closely with our colleagues with the administration piece. So if there is missing paperwork or we need to have a form signed, because we're on site, we can meet directly with the tenant to assist them with getting that paperwork completed. Or if they need help calling Revenue Canada because they need a notice of assessment, we're happy to assist with that as well. And then we also work on coordination where we are working to get the tenants involved in their building. So we organize and facilitate tenant engagement. We have meetings with them and encourage them to become involved. For example, a lot of our buildings have gardens and some of the tenants are not currently accessing that. We want to work with them so that if they want to, they can participate as much as they can in the building, accessing services like that.
Perfect.
Yeah.
Thank you, Jane. Not to put you on the spot, but can you share with us some of your background that you bring to this role as an SSC and as your compatriots do?
My background is social work, and throughout my career, I have worked with seniors. So it's a population that I really enjoy working with. And I also have experience working behind the scenes where I worked as a care coordinator with home and community care. So I kind of understand the ongoing needs that the seniors will have, and I want to work with them so that they can age in place and be safe.
Awesome. Thank you so much for that.
You're welcome.
Okay, so I'm going to now call upon Michaela. Michaela, Ciero, who is one of our tenant service administrators, to talk a little bit about her role and her experiences. We can go to the next slide, please. Over to you,
Hi,
Michaela.
everyone. Hi, everyone. My name is Michaela, and I'm, like Mike mentioned, I'm a tenant service administrator working within the integrated seniors model within Toronto Community Housing. And it's fitting that my turn came after Jane because my role is very varied. I get to work one-on-one with the tenants, but I also get to work collaboratively with the senior services coordinators by doing such roles as completing rent assessments and rent reviews in accordance with the Housing Services Act. The role of the tenant service administrator also contacts the tenants to follow up on any missing documents that may be required to complete the annual reviews, and may also send out notice of decisions regarding any rent changes that may take place. We also work on move-ins and move-outs and ensure that those processes go as smoothly as possible by, again, coordinating with the senior services coordinators and the superintendents. We also follow up with any documentation that may be missing, and we'll work with the senior services coordinator to connect with the tenant to get any information that's required. The other avenue the role of the tenant service administrator takes is one of providing administrative support, so such as printing out income tax letters during tax time. Your tenant service administrator is your go-to. Setting up pre-authorized payments and sending out correspondence regarding any annual reviews. Next slide, please. What I really enjoy about my role, about the tenant service administrator role, is that it allows me to have the opportunity to work collaboratively with many different people, the senior services coordinator, the superintendents, the supervisors, and the managers, so that we can aspire to deliver quality tenant service to you and make all the processes as seamless as possible. Thank you.
Thank you, Michaela. Really appreciate that. Thank you.
Thanks.
So, and last but certainly not least of the team to speak is Camila. And Camila is one of our senior superintendents, and she's going to speak to sort of her role, but also her role as it pertains to how it's worked in the ISM over the last year.
Thanks, Mike. Good evening, everyone.
Get the next slide,
yeah.
please. There we go.
Okay. All right. I'll talk about a little bit about my experience working together with senior service coordinators. So even though our responsibilities they appear to be very clear, we have to keep up with the maintenance requests, pest control, preventive maintenance, inspections, and things like that. We have to remember that we are dealing with people, with individuals, and sometimes these people, these individuals, they have different needs and concerns. So that's when the support from senior service coordinator helps us a lot to deliver a faster service to the tenants, faster follow-ups, more oversight of contractors to deal with contractors. For example, right now we are going through elevator replacement, renovations in the building. We just had the laundry provider exchange too, and the whole unit and stuff. And because we have the senior service coordinators working with us to address some of the concerns from the tenants and to answer questions and help them with some of the needs that could come up other than the ones that we are normally responsible for. It makes things easier not only for us, but also satisfaction for the tenants, which is the most important, which is what we try to do here, right? So it's pretty much it. So for example, in the last unit inspection that we did, it was a really positive experience in having the senior service coordinator coming together with us and meeting with the tenants and introducing themselves and explaining a little bit of what they would be doing there to help them. They are actually helping us to site staff to help the tenants as well. So in a very simple way, it's been a really good experience. I came from private buildings. I used to be superintendent too, and that's my first experience having senior service coordinators to help us with that. And I can tell for sure it makes a big, huge difference for everyone, for the tenants and for the site staff as well.
Awesome.
That's pretty much it. Thank you.
Thank you so much, Camila. That's great to hear. Appreciate that.
Thank you.
So I am going to now turn it over to Anna, who was with us today. Anna is one of our community housing supervisors, just to talk a little bit about some of the Southeast regional highlights from a building perspective and a community housing supervisor perspective. Off to you, Anna.
Thank you, Mike. Hello, everyone. My name is Yana Moraro. I'm a community housing supervisor, and my role is to ensure the buildings are well maintained, the cleaning and repairs are completed in timely manner. From the operations lens, I would like to provide you with some details on several capital work completed or ongoing in our region. In 17 Brimley, we have the painting and flooring project completed earlier this year. The lighting upgrade was recently completed. Accessibility upgrades, including barrier-free public washrooms, recreation room, the super's office, and some exterior accessibility upgrades. The work is still ongoing. In 80 Danforth, we have entrance doors replacement completed recently. The elevator replacement project just started. Accessibility upgrades in recreation room and super's office was recently completed. In our regional office, 145 Strathmore, we had the floor replacement and painting project recently completed. Lighting upgrade completed recently. Exterior cladding repair, the work is still ongoing. In 369 PAPE, interior accessibility upgrades, work is completed, and it's including accessible public washrooms and recreation room. The exterior accessibility upgrades, the work is ongoing. In 828 Kingston, we have the extensive holistic accessibility and energy savings project to be completed in 2022. The project is including window replacement, exterior cladding repair, and scooter charging stations. All entrances will be completely renovated next year. And multiple tenant meetings have occurred about this initiative. In 230 River, we have window replacement work planned to start soon. In 266 Donlands, we have the state of good repair. It's ongoing and will be completed soon. In 540 Queen, we have the landscaping upgrades to fencing and courtyard. We also have a number of small capital jobs to be completed in 2021, which is including painting of common areas of some buildings, unit renovations, and some exterior painting of buildings. We also have the new window washing contract for the region, and the work just started again is ongoing.
Awesome.
Thank you all.
Thank you so much, Anna. Really appreciate that.
You're welcome.
So I would like to take this opportunity now to introduce Jaypreet, our Manager of Access and Support. And Jaypreet is going to take us through some updates on some COVID-19 information and vaccination updates. Over to you, Jaypreet. Thank you.
Thanks, Michael. Next slide, please. So over the past year, we have successfully offered all senior housing unit tenants first and second doses of COVID-19 vaccine, and this was done in conjunction with our regional health and social support partners. COVID-19 booster vaccines are now available to individuals aged 65 years and older who have received their second dose 6 months ago or earlier. Starting earlier this month, we have begun coordination with regional health partners to offer flu vaccination and COVID-19 booster doses in seniors' buildings across the seniors housing unit, where possible, based on eligibility and availability of vaccines. To date, 36 buildings have been scheduled thus far. Tenants will be informed about clinics in their respective buildings through a multilingual outreach flyer that will be delivered to their doors. On-site clinics will continue to be scheduled over the next 3 to 4 months. Next slide, please. So moving on to partnerships and engagement, just a quick update. Pending further direction from the City of Toronto, Toronto Community Housing common rooms remain closed until early 2022, based on Toronto Public Health and provincial health guidelines. agency-led essential programs are gradually being reintroduced into common spaces with appropriate COVID-19 protocols and regional management approval. Tenant-led programs continue to be on hold, with plans being considered for resumption. Next slide, please. So to conclude, I just want to touch upon some of the work around our tenant engagement system. 60 tenant representatives have been elected so far across seniors housing unit buildings, including tenant committee members and community representatives. 25 tenant representatives were elected in the Southeast region, and this represents 13 senior housing unit buildings. Moving forward, elected representatives will participate in capacity building training to enhance their leadership skills and receive organizational support in fulfilling their roles. Tenant representatives will also meet as part of regional and city tables. Regional tables will also be established across the senior housing unit with a focus on the 4 senior housing unit regions. Tenant representatives, along with other senior housing unit tenants, can also look forward to upcoming tenant engagement opportunities that will include participating in focus groups for the new Toronto Senior Housing Corporation. Tenant engagement, the tenant engagement model overall will be reviewed as we move into the new corporation. So with that, I would like to hand off the presentation to Grant Coffey, our General Manager, to provide an update on the Toronto Seniors Housing Corporation. Over to you, Grant.
Thank you, Jaypreet, and good evening, everybody. If you can go to the next slide, please. So wanted to give everyone a quick update on where we are with regards to the Toronto Seniors Housing Corporation. As I think most of you would be aware, the plan is in place to transition to the new Toronto Seniors Housing Corporation by June of next year. And to achieve this, the new Toronto Seniors Housing Corporation was formed earlier this year, and a transition team was put in place. The lead of the Toronto Seniors Housing Corporation is Michael Sherrar, and Michael and his team are now working together with TCHC and our team on a joint transition plan. This joint transition plan outlines at a high level the different activities that have to be undertaken between the two corporations to support the transition. That plan is actually available both on the Toronto Seniors Housing Corporation website and the TCHC website. And I'll give you the address just later in the presentation. The Toronto TSHC, as they've been developing their plans, and specifically the transition plan, they have a meeting with the Senior Tenant Advisory Committee that we talked about earlier in the presentation in September to discuss the transition plan. And since they started meeting in June, there have been 4 meetings of the Toronto Seniors Housing Corporation board. There have been 3 tenant deputations since they've met, and different issues have been raised to the TSHC board in those deputations, including aspects related to the transition to the new corporation, issues around the integrated service model, the work we're talking about here tonight, broadly, and some day-to-day operational issues as well. And the Toronto Seniors Housing Corporation will be continuing to move forward and looking for more input and on the progress on this shared services review as we move forward. And in December, tenants will be invited to comment on the initial review around shared services and aspects that relate to tenant program elements or the touch points in the shared services that will have more direct impact potentially to tenants. This opportunity for tenants to comment will be facilitated and led by the Toronto Seniors Housing Corporation. And then in a broader context of communications and engagement, the Toronto Seniors Housing Corporation also held some tenant focus groups in October to get input on a joint communications plan. So the joint communications plan is a plan between both corporations around communication and engagement to support the transition to the new corporation. There's an information bulletin or mailer that is going out to tenants that explains some of the details around this transition. We'll show you a little bit of that in a second. And they have now launched the Toronto Seniors Housing website. It's torontoseniorshousing.ca. And on there, you can get more information on the transition, as well as linking to information on their board meetings and upcoming board meetings. For example, next week, they have a board meeting. Next slide, please. So plan by year end. So the Toronto Seniors Housing Corporation, together with TCHC, we're going to be looking to continue to work on how we can improve tenant communications as we move forward on this transition to the new corporation. The Seniors Housing Corporation wants to be able to respond to questions from tenants and concerns about this transition to get feedback. They're establishing the focus groups as noted. And the idea is to have tenants included and engaged for input into key aspects such as the shared services and other transition items. And their goal is to provide ongoing updates to all internal and external stakeholders. So in addition to the tenants, also staff and other stakeholders such as agencies and the city. Next slide, please. So to give you a sense of some of the communication materials that will be available and coming to tenants, I'll just walk through sort of what it will look like before and after the transition to help give tenants an idea of what will change and what will be different. So before June 1st, 2022, TCHC is still your landlord, so up until June 1st of next year. But after June 1st of 2022, Toronto Seniors Housing Corporation is your new landlord, so your landlord will change. Before June of next year, you will still pay your rent to TCHC and keep your RGI subsidy. After June 1st of next year, you will pay your rent to the Toronto Seniors Housing Corporation. It will be the same rent you paid to Toronto Community Housing Corporation, and you will still keep your RGI subsidy. So your rent will just be paid to the new Seniors Housing Corporation. Before June of next year, TCHC will operate the buildings and provide supports and services, currently as, for example, as we do now to the Seniors Housing Unit as part of TCHC. After June 1st of next year, Toronto Seniors Housing Corporation will operate the building and deliver the services and supports. And that will include the Seniors Housing Unit that's currently part of TCHC transitioning over to the Seniors Housing Corporation. Next slide, please. To continue, before June 1st of next year, you'll get timely updates about the transition in advance. And that will come from a blend of the Toronto Seniors Housing Corporation and TCHC. After June 1st, you'll get timely communications from Toronto Seniors Housing Corporation as the lead, because the tenants, you will be tenants of Toronto Seniors Housing Corporation at that point. Before June of next year, TCHC will own the buildings and will pay for all capital repairs. This is one thing that stays in place with the transition, in that Toronto Community Housing Corporation, TCHC, will continue to own the buildings and pay for capital repairs after June 1st. So even after the transition to the Toronto Seniors Housing Corporation, TCHC continues to own the buildings and pay for capital repairs. And then finally, before and after June 1st of next year, you can access the Office of the Commissioner of Housing Equity, or OACH, if needed. So that will be in place before the transition and after the transition. Next slide, please. So with regards to the Toronto Seniors Housing Corporation and this content and these items I've just gone over, they're providing an email address for feedback. So they're looking for feedback on what was just presented, and you can email them at info@torontoseniors.housing.ca. They're looking for input on specific questions that can be answered in upcoming communications. And they're also asking us to communicate out to all of the tenants and folks attending this session tonight that you can get information and get updates at their website. Again, it's torontoseniors.housing.ca. And with that, I'm going to pass it over now, I believe, to Mike for questions.
Awesome. Thank you, Grant. So that ends our presentation and us speaking to you. And now it's your turn to, ask some questions, etc. So before we proceed, I'm just going to review using Webex Q&A online. Right? If we can go to the next slide, please. So if you're online with the Webex, you can click the Q&A button at the bottom right of the video window. Type your question in the box to the lower right hand of your screen and click send. Only staff will be able to see your questions, and then your questions will be directed to relevant panelists for a response. Next slide, please. If you're using Webex over the phone, enter *3 on your phone to raise your hand and to lower your hand. When prompted, enter *6 to unmute yourself. Your name will be placed in the queue based on the order of who raised their hand first. The moderator will select and individually unmute participants with their hand raised icon. When you are selected and unmuted, you will hear a beep and a message saying that you have been unmuted. This means you can ask your questions. So we are all eager to hear any questions you have, and we're here to answer them as best as we can with what we can, right? So remember, press *3 and follow instructions. And on the computer, you can click the Q&A button and type your question in and hit submit. So.
Hi, everyone. It's Alana. I have an attendee with a question here. I'm going to unmute the attendee. When you've been unmuted, if you could please ask your question. All right, I'll go to the next question. I'll come back to you. So there's a question from the chat asking about elevators at 145 Strathmore Boulevard. And this is regarding with the regional work.
I am assuming yes. As of now, no work has been scheduled for 145 Strathmore. Those elevators are fortunately newer than a lot of others in the building. And our team and the facilities management team who evaluate which elevators get replaced have a plan. I know that there has been a challenge with one of the elevators recently, and we have our team looking at that and working on that. And I think Anna's got her hand up to give us a little bit more feedback.
Yes, I want to mention the fact that we have some issues with the elevator in the small building, and we did raise it with capital planning, and we've been told that it's going to be included in the next year capital planning, the replacement.
Awesome.
So that's good news.
Good news. Thank you.
You're welcome.
Thank you for your question or try one of the attendees again. You should get a request that you've been unmuted, and then please ask your question. The attendees that are using the computer, you might need to unmute. I'll go to, if possible, if you're having any technical issues, please put it in the Q&A and we'll respond to that next. So I have a question from the Q&A. What is the advantage to all this change? They're acknowledging that I know this question is late in the process.
I can start, and if any of our esteemed panelists would like to add on. But the biggest advantage to all this change is bringing services, senior specific services, closer to tenants in the buildings. So having the senior services coordinators working in the buildings. So in the old model, if someone needed something done or needed to speak to somebody, they had to trek all the way down to 423 Yonge Street to hopefully meet with their tenant service coordinator if they weren't busy or were available. Now we have staff in the building that are able to connect with tenants directly on all matters related to their tenancy, related to support, basically anything that the tenants are looking for from Toronto Community Housing. The other changes are working, Jay Preet's team working with our partners, to identify, better services, align the services better to the communities, working with the coordinators, the health coordinators, sitting at those health tables within the region to access supports and services quicker and more efficiently for our tenants. Does anybody else would like to add anything to that? No? Okay, great. Thank you for that question. That was a good question.
Yes, thank you. We'll try this, the attendee question. Anita, can you please unmute?
Okay.
Thank
can
you.
Hear me?
Yes.
Okay, good. Thank you. Thank you for your time. Jay Preet mentioned that the agency-led essential programs. The only thing is that some of the programs that are being considered essential because they're an agency are digital learning, art, that type of thing. To the tenants, they don't consider that essential. They consider health, food services, being able to interact in small groups. That is what they consider essential. What is the difference between tenants having engagement that is done following the rules and an agency doing what we consider non-essential?
Thanks, Anita. When we speak of essential services, social services also fall into essential services. A number of tenants have come forward and expressed their desire to start holding tenant-led programs. And we are working, as I discussed with you just yesterday, on ways that we can start to allow tenants to start initiating programming in our building. So what we're exploring at this time is looking for a agency sponsor essentially to take on the responsibility of some of the COVID-19 protocols and other elements of overseeing a program during this very challenging period that we're going through in light of COVID. But our hope is to start to reinitiate tenant-led programs over the next quarter.
Thanks, Jaypreet. I'll take another question from the chat. Just a reminder, if you're unable to, if you're calling in by phone, we'll reserve the voice for that. And if you could put your Q&A in the chat, so we can, that would be extremely beneficial. Reminder: no personal information, please. So I have another question from the chat about they had their it's been 6 months and they received vaccine number 2 in December. How will they be able to request for a booster?
Sorry, Lana, can you repeat that question?
That they received their, it's been 6 months as of December since their second dose. They were wondering how they could receive or request a booster shot.
So boosters are now available within communities through pharmacies, as well as there is a provincial portal where you can register to receive your vaccine off-site. We are working with our regional health partners. The challenge is that each of our regional health partners have different priorities. Some of them are offering boosters immediately. Others are waiting for the age limit to drop. So since our age limit in our buildings is tenants who are 59 years and older, they're waiting to be able to allow the whole building to be able to access the vaccination. So if there's an urgent need and you've reached the 6-month timeline, I would encourage you to utilize the provincial portal to register. And my understanding is that pharmacies across the city are also offering the booster shots.
Thanks, Jaypreet. I have another question from the chat. Is the office still to be at the same site on Yonge Street for tenants? I'm guessing this is the regional office.
Yes, thank you. I can answer that. So as part of the integrated service model, the seniors housing unit has been divided into 4 regions. So each region will have their own regional office. So for the Southeast region, the regional office, my office, and the team's office is at 145 Strathmore Boulevard. And each region will have their own regional office. And that information along with the senior services coordinator and staffing information is posted in every building in the information billboards. Good question. So obviously we haven't gotten that out enough, so that we need to maybe do a little more communication in the region to make sure everybody knows where the regional office is. The benefit and the beauty of the ISM is that tenants won't really need to attend the regional office for things, because they can work with their senior services coordinator on site to do a lot of that work, right? And to do a lot of the paperwork, etc. So thank you. Great question.
Mike, to add to what you just said, what I wanted to add, although we have the different regional offices for our 4 regions, a lot of the communication that we are sending to tenants are generated through our system, and the default address is still 423 Yonge Street, and we're working on getting that updated for all regions. So always just be mindful of your regional office that is posted up in the buildings.
Great, thank you. That's a very good point.
Thank you both. I have another question from the chat. I am a new tenant in TCHC, and I'm wondering why it takes so long to get repairs done.
Oh, well, I'm very sorry to hear that, because we do have service levels that we need to maintain, and our site staff need to maintain. And depending on the type of repair, it could take longer. But if it's a minor, what we call semi-skilled repair, which can be done by the superintendent or the custodial people, it should be done very quickly, within 3 days. Sometimes the work is a little broader, and we have to engage vendors and get quotes and such, and work through their schedule. But you know, if you would like to take this certainly offline, you could certainly connect with myself directly, and I can certainly address your concerns. Thank you.
Thank you. Another question from the chat. No thought was given to senior buildings, to the new washer, etc. How can we get this, I'm assuming, resolved? It cuts off. Thank you.
Okay, I'll take that one. So yes, as many are aware, that we TCHC had made a business decision to change the laundry machine provider from Sparkle to Coin-O-Matic. I've had many conversations with many tenants and received many emails, as many of our other managers, with regards to this transition. This transition was managed and from a corporate level, and it is not a local decision from the seniors housing unit. And you are correct that there are some things that were missed, much like some of the dryers and washers, the front load, are too low for certain tenants. So we are working with our vendor and our operations team who are managing the project to get pedestals in place. There was a miss on some of the larger washers and dryers that were in place with Sparkle, and we're working with the vendor to address those. The card loading machines came with only debit or credit options, and we're working to have in the entire seniors housing unit to have those replaced with ones that do credit and debit, but also take cash, because some folks, you know, aren't comfortable using the other technology. It costs money perhaps for them, depending on their banking account that they have, etc. So the feedback is important and appreciated and acknowledged, and that there are some things that need to be done. And be sure that from the first day of the rollout, our team have been working with the TCHC operations team to address the concerns. There are over 50 machines that would accept cash that are on order from the vendor. They come from overseas, and as you can imagine, with COVID and the transportation is going to take a bit of time, but it's in process. They're ordered, they're on their way as soon as they can get here. You know, some of the other concerns were, you know, the work that was done when they replaced machines, damaged walls, etc. So we are aware of the concerns. We are working on those with our operations team to address them. We hear you and we understand you, and we are working to fix that for sure.
Thank you. I have another question in the chat. At 230 River Street, we had a building cooling infrastructure upgrade approved last year. Will this project continue uninterrupted?
So the honest answer from me is I do not know. We recently added 230 River to the southeast region in late September. So we are in the process of catching up and getting a grip on a lot of the capital work that was done. So that is something that has been brought to my attention by our senior services coordinator, actually, who supports that building, has brought that to my attention as well. So we are working with the facilities management team to understand if that project is still on the go. And I would assume that I don't like to assume, but we will certainly look into that and confirm. So I understand that there is a concern in that community with that for sure. Thank you. Thank you for bringing that up.
Thanks, Mike. I have a caller. Caller, you will be requested to unmute. You should hear a request to do *6 to unmute yourself. And then please ask your question. Reminder, no personal information, please.
Hello.
Hi.
Hi, caller. We can hear you. Go ahead and ask your question.
Hey, I tried to get your meeting online. I couldn't figure that out. I tried several ways. And for the people that only use the telephone, which I'm using now, I had to find the numeric password on my laptop and then dial it in on my phone to get that. So the people that only have telephones and not computers would not have the numeric password because it was not included on the page that was given around door to door. And I know this is the first meeting, to get out of it, but that's one thing that maybe they could include the numeric password so that people would not have to look around for that.
So I'm sorry that you broke up a bit, but if I can recap, I think the concern was that you didn't have all of the information for the meeting with all the codes. We do apologize for that because this is a new platform that we are using. And unfortunately, last minute, we were told by our Webex partners that an additional password was required. We did try to get out the information early this morning to post in the buildings. And we did post it all on the website, and we do apologize for that. And we will do better for the next time for sure to make sure that we have that. The new technology is great and it allows us a lot more functionality, but unfortunately we weren't advised of the need for the additional password. So thank you for bringing that up. That's great. Appreciate it.
Thanks, Mike. I have another question from the chat. So far, my understanding, the rent is reviewed every year. What about if there is a change to my income?
I'm going to let Rejan answer that question for you.
I was just about to. Of the changes to the RTI rules, we do have to go based on your notice of assessment. If there is a change to your income and it is a 20%, would result in a 20% decrease, then we will go ahead and do an interim change or what we call a mid-year review. If your change in income is as a result of CERB, if you receive any benefits due to COVID, there are specific rules regarding that. So if you did receive CERB, I would suggest you follow up with your tenant services administrator. But for regular interim reviews, it has to be with a 20% change in your income. If you're not sure, if it is, just follow up with us and we can let you know.
Thank you, Rejan. I have another question from the chat.
Just 1 second,
Oh.
Alana, just before you do, I just wanted to specify that it's a 20% drop in your income now. That's mid-year increases. You don't have to actually report mid-year anymore, unless it's a change in the source of income. So just a clarification there. So yeah, whereas before all increases had to be reported, it's just the 20% drops now, or a change in the source of the income.
Thank you, Wendy. That's a good catch.
Yeah, because I know it was an issue with people before that they were really concerned with income increases that they had to report everything. But yeah, it's now in your favor. So.
Thanks, Wendy. I have another question from the chat. So the ISM is 1 year old. Where is the on-site medical component?
Repeat if I could bail upon you. Yeah, thank you.
As you may be aware, ISM is rolling out in phases. Over the past year, we have been, I think, the social housing system as well as the health and social support system have been preoccupied with responding to the COVID-19 response. We've been working very closely with our health and social support partners to offer COVID vaccine across all our buildings. So, I mean, this is a clear testament to how closely we're working with the health system to bring services into our buildings. We've been able to offer all of our tenants, that's around 14,000 tenants, access to COVID-19 vaccine. And that's not only the first dose, that's the second dose, that's the booster shots, as well as the flu vaccinations. Moving forward, we are working with the Ontario health teams across regions. Some of the initiatives that we're working on are aligning care coordinators to our building. So when our senior services coordinators do engage with tenants that may have a need for health or social support services, they have a more streamlined pathway to these services by working with care coordinators at the buildings. In East Toronto, there's a primary and community care response team, and our senior services coordinators also have access to that integrated table where, with the tenant's permission, their issues can be brought forward and tenants can be connected to health and social support services. Over the next year or so, we're exploring the possibility of virtual clinics across our region. So hospitals are keen on working more closely with tenants, and they've learned from COVID-19 as well as our tenants age, mobility becomes an issue. So we're collaborating with our health partners to look at opportunities such as virtual clinics across our regions. Thanks.
Thank you, Jaypreet. I'm not sure if I have another question from chat. I know we talked about laundry machines, so I'm not sure if this was already covered, but there was a concern that the laundry machines are not applicable or no input from seniors because they have been having issues working and utilizing them. How do we get this fixed?
Thanks, Alana. Yeah, as I stated earlier, there have been some issues certainly with the rollout, and we have identified major issues. Like one of them is, a lot of them are too low, so we're looking for pedestals to raise them up higher, so folks with mobility issues and can't bend as well, etc., will be able to use them. So we do acknowledge that there have been challenges with that, and we as a team have been working together with our operations team from TCHC to address those. And they are willing and understand the concerns, and it's going to take a little time, unfortunately, to resolve. Thank you.
Thanks, Mike. I had I guess a comment in the chat about that the provincial portal is not for AstraZeneca. Is there any feedback, I guess, from staff on where AstraZeneca booster or any feedback on AstraZeneca next steps for vaccine boosters?
The best place would be to utilize the provincial portals, and there are pop-up clinics being run by the regional hospitals across the seniors housing portfolio, and it would be best to check in with them. And if we still have some time, I'll try to find the provincial portal details and post them in the Q&A section.
Thanks, Jaypreet. We have another Q&A question asking can we have subtitles for every meeting as the sound cuts out and then picks up again? and sometimes the context of the Q&A is often lost. Thank you.
I can field that one. So we post all the recordings online afterwards, and we checked, and when we post it, it goes through YouTube, and you can do the text underneath for that. So that's an option. If the sound is not good on that recording, we also have for the Q&A section, we do have Patricia, our wonderful Patricia, taking notes for us, and we will be posting all the responses to the questions there for you. So, and if there's additional material that we didn't have in time for the meeting, we'll be posting that as well. So yes, that will be posted for you, so you'll have the complete answers there. Thanks.
Thanks, Wendy. I have another question from the chat. Do we need a new tenant account number after June 1st?
So that is a very, very good question. So as Grant had indicated in his presentation on the new corporation, one of the things they're looking at is shared services between Toronto Community Housing and Toronto Seniors Housing. So that would be one of the things they would be looking at, would be the IT, the systems that we use to manage our tenancies. So at this point, I can't answer that question, and hopefully we'll have that answer sooner than later. But that's a very, very good question, and one of the things that we need to put on our radar as we move forward, right? So once it's determined whether we will continue to utilize the same platforms that we use today in the new corporation, then the likelihood is it would probably just transfer as it is. But I can't give you a definitive answer at this time. I apologize. But a very good question and something we're going to take note of for sure.
Mike, maybe I could just add, thank you. So just to build on that, and thank you, Mike, there are many items or elements that we know that tenants will be interested in understanding. And so that is one of the goals with the transition, is to make sure that if there is anything that is going to change that will impact you as a tenant, that you're involved and aware of it. However, overarching, there is a sort of a general principle that the transition to the new Seniors Housing Corporation will be with as little to no disruption for tenants as possible. So the idea is not to disrupt your tenancy in any way. So how that plays out with regards to specific elements like this question about account numbers and things like that, yet to be determined, as Mike has said. But if there is something that needs to change, there will be, people will be communicated in advance. And the goal is to make it as smooth as possible, so there aren't any unexpected elements with the transition.
And
thanks.
I just wanted to add to that, Grant. On our December 8th meeting, Michael Sherrar, the transition lead for the new corporation, will be attending and answering questions and doing a small presentation as well. So, so there should be more opportunities to ask these questions and bring forward these concerns at that meeting. So the December 8th meeting, he will be attending. So.
Thank you, Wendy. I have another question from the chat. Will each individual regional office be for tenants, say complaints or whatever the tenant wishes to discuss? Maybe some additional feedback on what the regional office would be used for. Thank you.
Okay, great question. Well, certainly the regional office is where the managers and the supervisors are headquartered. We're not always here, but these are our offices, and the tenant service administrators, as well as our clerks and our rental clerks. Certainly, if a tenant wishes to meet with the staff at the office, that is an option once the office is open. As you know, they're currently closed, but absolutely that is an option. The hope is that if you have some concerns and complaints, that they can be resolved at the building level with your senior services coordinator. But absolutely, if one wishes to attend the office and make an appointment to come see us, that's absolutely fine. When we get to that point, for sure. And we are meeting tenants on appointment basis currently. But the intent is that hopefully most of tenant issues can be resolved without them having to travel. But you're more than welcome to come see us as well if necessary and book an appointment for sure.
I can answer that, Mike. Just to speak to what's been happening in our regional office right now, some tenants make one-off payments in the building, in our office, prefer to pay by debit. We have other services like parking. Sometimes the tenants like to come in person to drop the documents and not hand it to the SSC. So these are additional things that we do in the office that it's always open for the tenants to come in.
Thank you. We have a attendee caller who will be requested to unmute. If you will receive a voice prompt, if you could please star 6 to unmute yourself. Hi, caller, you've been unmuted.
Yes, I live at 585 King Street East. It's one of the newer buildings in the portfolio for seniors. And I moved in near the beginning when the building first opened in October 2014, within a couple of weeks of the opening date. And over the years, I've seen people that I would say don't qualify as seniors living here. And I know someone could move in with somebody else, but this is not a traditional rental situation where the tenant can just invite someone to come live with them because of the relationship we have with the TCHC. So I wonder, is there an inventory that TCHC does of the people who are actually living in the building, aside from the rent check and the identification that way?
Well, thank you for that. I'll take a stab at answering that. We do not do an inventory as such, but we do annual unit inspections of all the units within our portfolio. And if it's identified that there are people that are in units that should not be, but that doesn't necessarily mean we'll see that if we're doing the inspection, because there's a 24-hour notice, and if there's someone unauthorized in the unit, they may not be there when we're there. As far as people looking like they're not seniors, I'm 2 years from being a senior, so I may not look like a senior because our threshold for senior is 59, so it's a little low, right? So 59 and up is considered a senior in our seniors portfolio. And your building, much like a couple others in our portfolio, are a little different. It's not a rent geared to income building, but it's an affordable rent building. So the rules are a little different as well with regards to tenancy as well. And I think Rajan's itching to add some stuff for me. Thank you.
You're giving some good stuff here, Mike. So two things I want to add. The building has a community living program, and that program has tenants who are not seniors. We have a specific agreement with community living, so they house tenants who may have some disabilities. So that's one thing with community living. Two, affordable housing buildings, we only do the evaluation, well, not us, within seniors, the affordable housing team within Toronto Community Housing does the qualification at the point of initial tenancy. Once you move in, we do not do any re-evaluations of your rent. So it's a little more difficult for an affordable building as it is a building that's RGI, where you have to follow the RGI mandated rules, right? And because your rent is affected by your income, it really matters more for the RGI tenants who is living in the unit. Where we would worry from a seniors housing standpoint is if whoever's living in the unit is affecting the occupancy standards. So if there are way more people in the unit that should be there based on occupancy standards from the city's rules. But otherwise, there's no way for us to continuously evaluate an affordable building, who's living in the building. We do, however, encourage tenants at the point of lease signing. If you want to have somebody move in with you, they do need to do the addition to household.
Thank you, Rejan. I have another caller question. So caller, you'll be unmuted, requested unmuted, and you'll receive a prompt to *6, unmute yourself, please. You should be now unmuted. Please ask your question.
Hello?
Hi, we can hear you. Please ask your question.
Yes. My question is, what is the current status of an established senior in a TCHC building who wants to either move to another apartment within your seniors building or to another seniors building right now with Toronto Community Housing Corporation? And is that current status going to change in the new ISM? Will we be allowed to move to another apartment in our building or move to another seniors building within the ISM?
Great question. Thank you for that. So as you may be aware, Toronto Community Housing Corporation has a very specific transfer policy that was developed back in 2018 at the urging of the Ombudsman. So the only transfers that are considered currently are what we call crisis transfers or accommodations. So a crisis transfer is someone who's experienced or been the victim of crime or experienced crime in their unit or experienced a criminal act, or an accommodation for accessibility if one requires an accessible unit, or medical accommodations. And there's a process that exists today where an application is completed and either police reports and other things are required, or medical documentation from the doctor is required. It will go to an intake specialist who will evaluate the application and make a decision on whether that qualifies for the transfer process. I know in the past that there was lists for transfers and people could transfer from one community to another and they were put on a wait list, but that process no longer exists. As we move to the new corporation, will that change? We do not know. Again, there are going to be a lot of things that we'll be looking at as we transition, and if that process makes sense in a seniors environment or not, is to be determined. But as long as we are part of Toronto Community Housing, we follow that process and that policy, and that policy may continue with the new corporation or it may change. So I know that's kind of a wishy-washy answer, but it's the answer I have, unfortunately, for you today.
Okay, so what I understand from what you're saying, if a person like myself who is living in fear because of the proximity of criminal activity, unleashed pit bull mixed dogs, and legal senior tenants taking in young street people into their bachelor apartments and asking them for rent. With all this going on, if I'm living in fear and there's illegal activity and the police have been on site about these issues, that I can then put in a request for a transfer to another apartment in my building or even out of my building to another building within the system?
Well, what I would recommend for you specifically, we could take that offline, is to connect with your senior services coordinator at your building to discuss the issues and relate to them the exact specifics, and then they could counsel you on how to proceed. So it's very specific that you know, under a crisis, that the tenant is the victim of a crime in their unit or in the community. But certainly have a discussion with your senior services coordinator and share with them the details of the events, and they can certainly counsel you and assist you with the process if necessary, for sure. Okay? Thank you.
Thanks, Mike. I have another from the chat.
Alana, just before you do that, I just wanted to bring forward, I've worked as part of the service manager at the city, and I can tell you for transfers between units, between buildings, for all of the housing portfolio, for the entire social housing portfolio within the City of Toronto, there are no internal transfers currently allowed. That's basically been eliminated at the moment because it's taking away from people being able to move into social housing. So I would not anticipate that changing. I won't say it won't for sure. You never know what will happen, but from the temperature of what's going on in the entire city, I would not anticipate that changing. So in most cases, people wanting to change would have to reapply to the centralized wait list. So there is an option, but it's a very, very long wait. Just to sort of manage your expectations. Thanks.
Thank you, Wendy.
Yes, thank you, Wendy. So the question from the chat, will we be given contact info for the new senior tenants coordinators that have been assigned to our buildings as recently posted? I'm guessing it might be senior services coordinators.
So I can answer that. All information for the senior services coordinators and tenant services administrators for the buildings have been posted all throughout the buildings. And if you're ever not, like, if you're not sure, just ask your super where you can get this information. But for every single seniors building that we have the ISM running through, we have everything posted up all throughout the building. And you can always call the client care as well and just find out who your senior service coordinator is or your tenant services administrator, and they can point you in the right direction.
Thanks, Rajan. There's a lot of great questions coming through, everybody. It's great to see engagement. Again, reminder, no personal information. If you are a caller, to raise your or lower your hand, please press *3. And we will add you to the queue with the questions as well. So I have another chat question. At 230 River, I was shown plans for window changes. At present, a tenant may sit in front of an open window. The new designs will not permit this. I am concerned.
Okay, thank you for that. As you're aware, the design, it is currently in the design phase, and it is my understanding that there will be some additional tenant consultation on the designs of the windows if it hasn't already taken effect. As I indicated earlier, this is one of the buildings, 230 River Street, that we recently took the management over in the Southeast region. So I can certainly follow up on that to see what the next steps in the process are. Thank you.
Thanks, Mike. I have another question in the chat. Referring to the earlier question, did you mean that tenants can have their own kind of YouTube from home apartment or belong to a course of what will be chosen to follow in the building? Sorry, if those are that, do you mind resubmitting some additional details?
They might be talking about videos, sort of, videos for checking in or something like that. If you have a YouTube channel for your security video, something like that. I'm wondering if what they might be what they're referring to. Brad, are you able to answer that one? Do you know what they might be talking about?
I'm sorry,
I
no,
think
I don't have any idea what that relates to.
Okay.
I think it was relating to your answer about subtitles, and I think in that so I think it's relating to that.
I'll keep monitoring the chat, see if there's additional details. Another question is, who will do our rent review after June 1st? Will it be the same TCH person we've been used to dealing with?
Well, the intent is that the current staff that support your building and the current staff from the seniors housing unit will be the new staff at the Toronto Seniors Housing Corporation. So the staffing should not change. The intent is to move as of June 1st. I will become an employee of the Toronto Seniors Housing Corporation, as will the staff that work with us. And that should not change for you, should they choose to move to the new corporation.
Thank you, Mike. Another new corporation question in the chat. Since it's a new corporation, will tenants receive new leases?
If you want, I can take that one. So we're currently working through, it's Grant here, we're currently working through what will be required to transfer the tenancies between the two corporations, and what that means from a new lease perspective. It's not anticipated that a new lease will be required, but the lease will be assumed by the new corporation. However, the specifics of that are still being discussed. So if there are any requirements for that, tenants will be advised. There will likely be a notification with regards to a change in a change in landlord that will be provided, but we don't anticipate a need to redo the lease. However, I will leave it with that is still under some review. We actually have an internal working group that's been formed to look at this particular matter, and we're going to be going through that. And if anything comes up, we will let tenants know, one way or the other.
Thanks, Grant. Another question from the chat. Will seniors be able to keep existing care that is in place? Will they be able to continue to use their choices for medical care, or a combination of both? Will this model move into the realm of what happened over the years with long-term care?
So no, tenants won't be forced to use any particular medical care. This is all about providing options to tenants in their home and in their home community. If a tenant wishes to engage in their own medical care, that is up to them. It's a purely voluntary system to take part
in. Thanks, Brad. Another question in the chat. When will interrupted building elections be allowed to continue so that we can elect committee representatives to TSHC events?
With regards to the community engagement in the elections, we currently follow TCHC's lead and protocols on this. What will happen is that this will be an undertaking of the new Seniors Housing Corporation. And after post-June the 1st, the Toronto Seniors Housing Corporation will be able to implement its own tenant engagement system. But as Mike said earlier, and up until June 1st, we continue to be Toronto Community Housing and continue to abide by their policies and procedures.
Thanks, Brad. Another question in the chat. Can we have the windows cleaned before June 1st? With the company willing to book inside window cleaning by and paid for by the tenant?
Yeah, so in cleaning the inside of the windows and inside the unit is the tenant's responsibility. That's not something that our vendors would do. They only clean the inaccessible windows on the outside of the building. With regard to having somebody do it and a tenant paying, that would be completely up to them to have somebody in their home and pay them to clean their windows.
Thanks, Brad. Another chat question. What can seniors do if they want a unit larger than their bachelor unit?
So as Wendy was saying, transfers between units are not done by TCHC or Toronto Seniors Housing Corp staff. If you're requesting a transfer for a non-priority category transfer simply to upgrade from a bachelor to a one-bedroom or to get a unit in a different building, you'd need to go and apply at Access to Housing, and they would process your application and put you back on a wait list. I believe that they do give some preferential time to the date of your original application, however, though.
To add to what Brad said, if the request for a larger bedroom size is as a result of an accessibility or an accommodation, that could be done internally, and you will need to fill out a medical questionnaire and a transfer application. I would suggest you follow up. If that is the case, you should follow up with your senior services coordinator, and they can guide you through the process.
Thanks, Rajan. I think I saw a call-in user raise their hand, so I'm going to try to unmute the call-in user again and see if there's any additional questions they had. So a reminder, to unmute yourself, please press *6. Caller? All right, I'll go back to the chat. In the meantime, are central AC and Wi-Fi being considered for senior buildings under the ISM?
So with regards to central air, it's really not feasible in most of the buildings. We've done a few retrofits or looked at them, but unfortunately, due to the way the heating system currently works in the buildings, it's not really feasible. With regards to Wi-Fi within the buildings, this is something that we're trying to pilot right now in a couple of locations. We've entered into a partnership with an outside agency, and they're looking at assisting us with providing seniors with Wi-Fi in the common areas as well as some of the units. Depending on the program and the uptake and its success rate, we may be able to roll it out to other buildings.
Thanks, Brad. I have no new questions. Again, a reminder: if you're on the phone, to raise or lower your hand, *3. If there's any other questions, please put them in the chat now. Not seeing any new comments. Is there any final words you want to say?
Alana, I'm just noticing there might have been a question there about making people aware of the Rogers 999 connect, the lower cost internet thing that's available. Maybe we could have somebody speak to that for a sec. I see something's popped up there on that.
Oh, thank you. Can you reiterate on the Wi-Fi? Do you have the option of free internet?
No, there's no option for free internet at this time. It's coming out. It's in a pilot program that's being carried out in a couple of buildings, select buildings. And like I said, once the program is rolled out further, if we're able to expand it, we'll notify tenants in the buildings.
Another chat question is, regardless AC, it is no longer a luxury, but a need. 2 years ago, people came into my building who had window ACs and replaced them with portable AC. Why can't this be done?
So that program was in response to a tragic event that occurred in one of our communities. And a directive and decision was made by the executive team that window air conditioners were no longer permitted in Toronto Community Housing Corporation buildings. That was an exchange program. So anybody who had an existing window air conditioning unit in their unit were given a portable floor model to replace the window AC unit. So we were not providing ACs to people who didn't have any. We were just simply replacing it. So we made the decision as a corporation to, no longer permit the window air conditioners. And as a result, if you had a window air conditioner at the time, you were asked to remove it, and we replaced it. And we took that out of your unit and replaced it with a portable air conditioning unit. So, thank you.
Thanks, Mike. I'm going to try one of the call-in users again. Just seeing still some hands. I'm going to try question unmute. Again, if you hear the prompt, please *6. Looks like, yes, no response from the callers. We'll go back to the chat. How big does a seniors building have to be before the super and other TSHC officers are there full time?
Ed, could I avail upon you to answer this question? We had this discussion this morning, actually. Perhaps Brad has abandoned me. So it is not necessarily the size of the building that dictates the staffing structure. And I understand where this question may be coming from, because we have certain communities that are smaller that share resources with other buildings. And so to ensure that there's appropriate coverage, we have appropriate staffing levels. However, we have staff that may travel from one building to the other at times. The hope for us as we move to the new corporation is to reevaluate some of the staffing model that we have today. But we are currently, under Toronto Community Housing and the constraints of our budget that exists today. So we've done our best to ensure that there's appropriate staffing levels in every community throughout the portfolio.
Just wanted to let everybody know for a few minutes we had some vaccine information up on the screen, and that will be in the recording that will be online. So you'll be able to find that. So it'll be at approximately just before the 2-hour mark on the YouTube video once it goes up online, and we'll try to get that information out in other ways eventually to you as well. But yeah, we did have that up on the screen for a while. I know callers, you couldn't see that, so but it will be available online, and yeah, we'll continue to seek other ways to get you that information as well.
Thank you, Wendy. So if we have no other questions in our Q&A or online, we are now at 7:58, 2 minutes before end time. I would like to thank everybody for attending and everybody for asking some great questions and being interactive. I'm very happy that we had the opportunity to hear from a lot of you. As Wendy had indicated, be sure to check our website at www.torontohousing.ca/ISM for a recording of this and previous information sessions, presentation materials, details and updates on future information sessions, other ISM information and updates. Reminder that our next tenant information session is on Wednesday, December 8th from 6 p.m. to 8 p.m. Also, if you have any questions, please contact Patricia Santana Senior Housing Unit at patricia.santana@torontohousing.ca. I'd also like to mention that we have not displayed this, but as part of this presentation, which will be posted, there is an appendix that indicates some more information on the Southeast region as to the buildings and the senior service coordinators that are assigned to those buildings and work in those communities. So that's a great resource once this is posted to look at that. Obviously, the information is also posted in your communities, but it will be available on the website as well. So on behalf of the team and all present and the SHU staff, I really want to thank you again for taking time out of your day to spend with us for the last 2 hours, and really appreciate it. And I think it was great to get together. Thanks, and have a great night, everyone.
Thank you, everybody.
And some thank yous from the chat. Thank you, participants.